Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. Today, let us learn something about Medicare Advantage Plan or Medicare HMO or Medicare HMO. It is called by a number of names, but doesn't matter. I think it is very important for us to differentiate that from the traditional Medicare and Medicare supplement plans. Okay, let's jump into the Medicare Advantage plans. If you are within 3 months of your 65th birthday, then you need to seriously consider your healthcare plan. You will automatically get Medicare Part A, which is the hospital coverage, a month or so before your 65th birthday. However, you have to look at alternative plans for covering doctor's visits, outpatient tests, prescriptions, and many other things. That brings us to Medicare A, B, C, and D alphabet soup. What in the world is this? Medicare A, B, and C. I thought there was just Medicare. Who created all these divisions? What do they mean? Why do I need A, B, C, D, and different plans? All right, calm down. Medicare Part A covers hospital charges. And don't forget, you may have like $1,000 deductible when you are admitted to a hospital. Medicare Part B is something which you have to sign up, and it is very important for you to make sure that you go to the Medicare website to sign up for Medicare Part B, and you can do that if you are within 3 months of your 65th birthday. And we'll talk about the pros and cons of all these different plans. So don't worry, everything will be cleared by the time this presentation is completed. Then we have this Part C, which is called the Medicare Advantage Plan or Medicare HMO or a PPO or a point of service. They may have multiple names, but the bottom line is Medicare Advantage Plan is supposed to take some hassle out of you because it will cover Part A charges, it will cover Part B and outpatient charges, and it will also provide some prescription plan. But anything that sounds so good, you need to be a little bit concerned, and we're going to look at the pros and cons of a Medicare Advantage plan. The most important thing is Medicare Advantage plan for you? Does this fit your overall medical needs? That's the most important thing. I'm not saying that Medicare Advantage plan is bad and traditional Medicare is the best, but it's your decision as to what fits best for you. That is the bottom line. And Part D is a prescription plan that covers costs of your prescription. Even there is the so-called donut hole where you will end up paying money if you reach that donut hole gap. Okay, let's stick to Medicare Advantage plan for this presentation. As I told you, as soon as you are close to your 65th birthday, you may get zillions of mail recommending you to sign up for their Medicare Advantage plan, saying their Medicare Advantage plan is better than all the rest of the Medicare plans. Don't fall for that. And even I would suggest you can talk to your friends who have been on this Medicare Advantage plan, but that's not going to answer all the questions. This video presentation is going to look at what is in your best interest. As you listen to the rest of the presentation, you will understand points that you need to focus when you select a Medicare Advantage plan. And before that, you have to decide, is the Medicare Advantage plan the right insurance coverage for you? Because once you sign up, there may be some limitations, there may be some waiting period before you can switch, and we're going to talk about that. Basically, Medicare C or Medicare Advantage plan replaces your Medicare Part A, it replaces your Medicare Part B, and of course it provides prescription plan, and also some of the plans can provide additional benefits, which we're going to talk about in a minute. All right, let's talk about some of the pros and cons of Medicare Advantage plan. Whoever is selling you the Medicare Advantage plan, you have to understand it is a salesperson. That person is selling you an insurance product. That means that person has a vested interest in getting commission. So you have to decide what is in your best interest. Yes, some of the Medicare Advantage plans may have no monthly cost, and there are some other plans where you still have to pay for your Medicare Part B. That might have changed by the time you watch this video. And the Medicare Advantage plans have a maximum of $6,700 out of pocket cost per year. I want you to remember this number very, very carefully, because we're going to take this number and compare to the old fashioned traditional Medicare and see which one best suits you. Medicare Advantage plans cover prescription, so you don't have to get a separate Part D prescription plan. Medicare Advantage plans generally cover limited dental, vision, and hearing costs. I said limited because they are not going to pay for an entire root canal or a total replacement of your dentures. An important thing that you have to keep in mind. And you can switch from one Medicare Advantage plan to another one, but that can only happen during the so-called Medicare enrollment period, which is between October 15th and December 15th. But let's look at the disadvantages of a Medicare Advantage plan. Let's say you have a Medicare Advantage plan. You go to your doctor's office. You have to pay a copay, which can be more than what you would normally pay if you had the traditional Medicare with a supplemental insurance. So don't forget, some of the patients who come to my office with Medicare Advantage plan have $50 copay, which is almost equal to half of what the cost of office visit is. It is very difficult to evaluate different Medicare Advantage plans. And remember that a lot of these Medicare Advantage plans were created with a pool of patients in a local area. So most of these plans are administered locally, unlike a traditional Medicare, which is nationwide. And here's an important thing. A lot of these Medicare Advantage plans are not very attractive to the physicians for a number of reasons, which I'm going to elaborate in a minute. And that's why all the doctors may not be on your Medicare Advantage plan. Especially the specialists shy away from these Medicare Advantage plans because they are extremely difficult to deal with. Too many roadblocks between you, the patient, and the doctor. Similarly, major hospital chains may not be in your Medicare Advantage plan, and that can put a severe limitation as to where you can get elective medical care. And the worst thing about Medicare Advantage plans is that you need a referral. For everything you need a referral. If you want to see a cardiologist, or if you want to see an ENT doctor, or any specialist, or if you want to get an X-ray or an MRI, you need referral. You need authorization. And all of these take a tremendous amount of time, resources from doctors' offices, and that's one of the reasons most of the doctors are not very fond of these Medicare Advantage plans. And here's a continuation of the disadvantages of a Medicare Advantage plan. As I told you, many doctors don't like the Medicare Advantage plan at all. Especially the specialists, they just don't accept any Medicare Advantage plans. The payments from the Medicare Advantage plans are generally less than what a traditional Medicare would approve and pay. And most Medicare Advantage plans have like a 60-day time limit to file the claims, and when we send the claims, a lot of times they don't get it, and a lot of doctors tend to lose considerable amount of money dealing with Medicare Advantage plans. There's tremendous amount of office overhead involved in collecting money from Medicare Advantage plans. As a result, most specialists try to shy away from these Medicare Advantage plans. And as I told you before, most Medicare Advantage plans are sort of involving a pool of patients in a certain region or a certain city geographic. As a result, these are all very local plans. Whereas if you have a traditional Medicare, your coverage could be anywhere in the country and you don't need any authorization, you don't need any referral. You can choose the doctor you want, you can choose the hospital you want. So there are differences between the two different plans. Okay, somebody has already talked you into Medicare Advantage plan, and you have no idea how to go and evaluate Medicare Advantage plan versus traditional Medicare. Your friend is on this program and this patient, your friend has no medical problems and thinks this is the best plan to use it. I said, hold on, wait a minute. If you are healthy, if you have no medical issues, any plan is good for you. But if you have multiple medical problems, if you are on 8 to 10 drugs, then I would say think twice, 3 times, maybe 4 times before you decide which is the best plan for you. Medicare Advantage plan versus traditional Medicare. All right, you have already been brainwashed to go onto a Medicare Advantage plan where you pay zero amount. There is no copay. Don't believe that. Any plan that cuts down the cost on the patient side is cutting down the cost on the physician side, which means most of the doctors are not going to be on your program. Even the doctor you were seeing before you reach your Medicare age may not be on your program. Before you sign up with a Medicare Advantage plan, I would say seriously look at, are your doctors on the plan? Are your doctors accepting these plans? What is your out-of-pocket maximum? It says $6,700, but you have to understand that you may end up spending more than that for additional costs which you may not know when you sign up. Do they cover all the drugs that you are on? So when you call the insurance company, ask them, do they cover all the drugs you are on? Some of the drugs that you are on may not be covered, and some of the drugs may be declared as experimental or research, and you may not be able to get that particular medication. And more importantly, you need to find out how you can get out of the plan if you are not satisfied with the plan, the doctors, or their terms. And here's a little catch. All Advantage plans will tell you, we provide you dental, we provide you vision, we provide you hearing, all these things. All those things are important. But the most important thing is, are your doctors on your plan? Are the hospitals close by your location? Are they on your plan? Those are very important things. Do you have a freedom of choice? Can you go anywhere and be able to use your insurance? And these are the valid questions that you need to ask yourself and the agent who is trying to sell you this Advantage plan. Okay, who are the major providers of Medicare Advantage plan? AARP Complete by United Healthcare and all the other major insurance carriers such as Blue Cross, Aetna, Humana, Cigna. I would be very leery about real small Medicare Advantage plans because of their size, the number of doctors and the number of hospitals and the number of services that are covered may be very limited, and you have no way of knowing what is covered and who is on the program or what are the benefits that you're going to get. So if you are going to go with a Medicare Advantage plan, I would suggest you go with one of the major Medicare Advantage plans. For example, AARP Complete or Blue Cross, they could provide you nationwide coverage. And these are the things that we really need to look into before we sign that, because once you sign, you are stuck with that program for an entire year. You cannot change the program in the middle of the year. Why should you go with a Medicare Advantage plan? The only reason you would go with a Medicare Advantage plan is because somebody has told you that it's going to cost you nothing, which is a lie. And somebody has told you that you get everything. Part A, Part B, prescriptions, eye care, dental care, hearing, and everything. Hold it. Compared to what? At what cost? That brings us to the old traditional vanilla Medicare package for the whole year. So when you compare a Medicare Advantage plan versus a traditional Medicare, I would say compare your total cost per year What is your total cost per year with a Medicare Advantage plan, and how does it compare if you have a traditional Medicare plan with all the supplemental insurances? And here I'm going to show you the difference. For example, let's say you're 3 months into your 65th birthday, and I convince you to go with the traditional Medicare, and most other doctors would, and especially if you can afford the monthly premiums. Medicare Part A is zero. Medicare Part B premium is about $160 to $175. AARP supplement or any other Medicare supplemental insurance. If a doctor bills $1,000, if Medicare approves like $800, it pays 80% of $800, which is $640. Then the remaining 20% and some of the copays are covered by these so-called Medicare supplemental insurances. Don't get confused between Medicare supplemental insurance and Medicare Advantage plan. They are two different animals. The supplemental insurance can cost you $150 to $165, or it could be much less based on your overall medical history and your income level. AARP also provides, or any other, when I refer to AARP, I'm talking about all Medicare supplemental programs. Supplemental prescription plan may cost you about $50. You can get a supplemental dental insurance for about $50, which may cover half of your dental costs, which is not bad. Okay, the total monthly cost, if you go with the traditional Medicare, where you have no restriction as to which doctor you can see, where you have no restriction as to which hospital you can go and get your health care, where you have no restriction nationwide, your total monthly cost would be $440, and your yearly cost $5,280. This we are talking about yearly premium. If you incur a lot of medical services, your copays could add up to a certain degree. Just a few minutes ago, we learned the maximum out-of-pocket cost with the Medicare Advantage plan was like $6,700. Of course, there's no upfront cost with Medicare Advantage plan, because with traditional Medicare, whether you are sick or not, you have to pay these premiums. But it's like an insurance, You live in the house, you pay homeowners insurance. You drive on the street, you pay auto insurance. So this is an insurance. This approximately $5,280 will cover your hospital charges, your Medicare doctor's visits and outpatient tests. It covers your supplemental costs, and they also cover prescription. They also cover, to a certain degree, your dental. So this is almost similar to what you would get with a traditional Medicare, but much more freedom. You have a freedom of choice as far as the doctor is concerned, as far as the hospital is concerned. You can go anywhere. There's no restriction. You don't need any authorization to get a test done. Those things are very important. For me, I think I want to be able to make my own medical decisions. I don't want an insurance company which is profit-oriented to make decisions on my behalf. That's me. It's up to you, because you have to decide what is best for you. I can only provide you with the comparison, the cost-benefit ratio, and limitations when you deal with a Medicare Advantage plan compared to a traditional Medicare package. All right. Here are some additional factors you need to take into consideration when we are talking about a Medicare Advantage plan. The enrollment period is between October 15th and December 15th. That means once you enroll, you're locked into that plan for a whole year. You can only change during this enrollment period. But if you enrolled in a Medicare Advantage plan and you want to switch back to traditional Medicare with all the supplemental coverage which I talked about, then you may have trouble getting supplemental insurance. That's an important question you need to ask when you sign up with Medicare Advantage plans. As the insurance agent, if I decide to go into a traditional Medicare, will you be able to provide me supplemental insurance? Say, for example, Blue Cross or AARP. And if you get their Medicare Advantage plan and you decide to go into traditional Medicare, you want to use their Medicare supplemental insurance. would they have any restrictions? If they say there's going to be restrictions, then that's bad news. So I would say think once, twice, three times, four times before you sign up with any plan for that matter. So I'm not trying to sell you any product here because I am a doctor. I don't sell insurance. I'm trying to see what is in your best interest, especially if you are able to afford that $5,000 to $6,000 in premium. I would say go with the traditional Medicare, Medicare supplement, dental insurance, and prescription plan, because you are like a free agent yourself. You can go to any hospital, you can see any doctor, and you can get any kind of procedures without having to go through the hassle of getting authorizations and referrals and all the things that we talked about. Before you embark on anything, I would say visit the website of the insurance company. Call them up and ask hundreds of questions, because if they take an hour to pick up the phone and answer, that's how they're going to be responding to you when you are in their program. If you don't get prompt answer, if you don't get satisfactory solutions to your dilemma, then you think twice how it's going to be once you have signed up. If you find out your doctors are not on the program, then maybe it may be too late. So these 3 months are the most crucial time in which you have to evaluate each and every Medicare Advantage plan that you are presented with, or at least take a half a dozen and call each one of them and ask all these questions. Make a list of all the things that I have talked about that you need to ask, and ask them and see who can best answer your questions and if that plan is the most suitable one. But the most important thing is, if you sign up for a Medicare Advantage plan and you want to switch to a traditional Medicare with supplemental plans, you may have limitations. Whereas if you're on a regular Medicare plan, then you want to switch to a Medicare Advantage plan, then you don't have that problem. I am speaking to you as a doctor because I see what is in your best interests, because I have been in this medical profession for 30 plus years and I have treated thousands of patients, and I know what is in your best interests. So you be the best judge and see, taking all the points into consideration, and see what best suits you. I hope this has been educational for you. I hope this has been useful for you to decide what best suits you. Okay, that's my pitch on the pros and cons of Medicare Advantage plan, and also Medicare, and also traditional Medicare with supplemental insurance policies. The decision is yours. And please do subscribe to our YouTube channel, where we can kinds of educational programs. And also we have a social media page, which is NNN Media. Please do visit our page, like it, and we will see you next time. Thank you.